Hello, everyone. Welcome to the Autism Hour Summit, April 2022 with PlayStreet. My name is Melillo Method. I'm the founder of PlayStreet, Bangalore, India. I'm an RDI consultant, OPT and a feeding therapist, an AEC program co-creator called the Play Talk program, and an Access Bars facilitator. PlayStreet is an organization that provides educational services to help a child with special needs become independent and live up to their potential. Offer parent empowerment programs and integrated schooling programs and a variety of clinical services. As April is Autism Awareness and Acceptance Month, we wanted to bring to you the pioneers in the field of autism to guide us all and spread more awareness and knowledge. Today is our 15th talk, and our incredible speaker for today is Dr. Robert Melillo. I'll introduce Dr. Melillo. Dr. Robert Melillo is one of the world's most sought after and respected experts in developmental functional neurology, brain imbalances, hemispheric integration, and the diagnosis and correction of most neurobehavioral disorders and learning disabilities. He's also a successful businessman, an entrepreneur, and has developed many successful businesses. In 2006, he created Brain Balance Achievement Centers, which has approximately 150 centers and has helped tens of thousands of families. He's a prolific author and a brain researcher. He has published one major textbook titled Neurobehavioral Disorders of Childhood and Evolutionary Perspective. He has co-authored approximately 20 chapters in other texts on various subjects related to dyslexia, attention, frontal lobe development, etc. And he has also published approximately 50 peer-reviewed papers. It's our honor to have him in the summit today and talk to us. Today, we are going to talk about the Melillo Method and its benefits for children with autism. Welcome, Dr. Melillo. Would you like to start with a word?
Thank you very much for having me. I mean, this is such an important thing to me, and the fact that it's, April and Autism Awareness Month. I'm just very happy to be here. And again, I'm working with many families over here that come from India, and so I believe this is a big issue for that country and for the world really right now. So I'm very happy to be here.
Let's start with understanding the approach you created. What is the Melillo Method? What made you create such a program?
The Melillo Method is really the culmination of really 30 years plus of my work, both my clinical and research experience. And much of this started really with my own personal journey with my children having different issues. And really, for me, it all started with one main question, which is what is actually happening in the brain in a child that has any neurobehavioral disorder, but especially autism, which seemed to be the most mysterious of them all. And so, that journey really brought me to understand what the actual problem was. And then from there, develop a program, a clinical program that could work to correct or help to improve the underlying factors, and also understand what might be some causative factors. So it's a clinical program that is designed to address individually what is actually happening in the brain. And we use a multi-sensory type of approach where we use different types of sensory stimulus, motor activity, diet and nutrition, cognitive-based activities. And all of it is designed specifically toward the individual to really address the underdeveloped area of their brain and improve coordination and integration between different areas of the brain.
Over the past many decades of research done by you and your team, what have you understood about the autistic brain?
First of all, one of the things I think that's important to point out is that, as I tell parents all the time, that kids that end up with autism or any neurobehavioral issue are really they end up that way because they're really gifted in an area of their brain. They literally have genius level skills. And that's what our research, and I think other research has shown, is that what we see is that there's this developmental imbalance in the brain. And part of it is built on traits. It is not built on gene mutations for the most part. There is, a small percentage of kids that have any sort of genetic mutation, but the majority of autism, there is a functional imbalance that starts primarily in childhood and even in the womb, where the right brain or the right side of the brain, certain networks in that area of the brain are halted or decreased in their development and maturity. And they're superimposed on generally in the family, we see that people with autism have extremely strong left brain skills. And these kids are generally very dominant in that side. We see that they have more what we call local connections or short range connections that are very powerful. So this left side of their brain is kind of over-connected with these very powerful short range connections. And the right brain is immature and underdeveloped. And then there's a delay in the development of long range connections between the two hemispheres of the brain. And these combinations, depending on what specific areas and networks, lead to really all of the symptoms and all of the issues that we see in autism. And again, like I said, it's built on really the fact that their left brain is exceptionally good and strong. And if the right brain doesn't keep pace, it provides this disconnection where the two sides can't communicate. And this is known as a functional disconnection.
So now when you're talking about functional disconnection syndrome, functional disconnection, would you elaborate a little bit more on this term and what kind of symptoms do we see?
Yeah.
When you say the left brain is so highly functional and right brain is underconnected. So
sure. Well, functional disconnection is, most of what the research since the 90s has really been around what we call functional connectivity in the brain. It's really about the way that the brain communicates. It's not so much about physical connections. It's about timing and synchronization and coordination in the brain itself. So there's a delicate balance within the brain and the way it communicates and the processing speed. And what we look at is different brainwave activity like beta, theta, delta, alpha, and how brain waves communicate that way. And what we see as far as symptoms, the left brain is really the logical, linear, very highly detailed brain. So we know that the left brain is good with basic mathematic operations and word reading and spelling. It's very analytical. It likes to do the same thing over and over. It's likes familiarity. The left brain is a little bit of a risk taker. The left brain governs what we call approach behavior. The left brain is more individualized. It's more goal-directed, and it governs what we call seeking behavior, where we kind of have a goal and we go out and we seek the world. It's more motor-driven. So the left brain has a tendency to be physically hyperactive. We can see tics and hyperactivity and movement issues also come from the left brain being very high. The left brain, because it likes familiarity, it tends to be somewhat compulsive and obsessive and can be addictive. When we look at tics or stims, all of them come from overactivity in various networks in the left brain with an area, what we call the basal ganglia. The left brain, again, governs different emotions, but the primary emotions are either happiness, and we often see that many kids with autism sometimes laugh or are very giddy for no reason, or anger. And we see that many of them may have a problem where they have temper tantrums, especially if they get frustrated. The left brain is very goal-directed, and it is reward reinforced, which means when we get close to a goal, we get a reward. So very short-term, but very focused attention by the left side of the brain. So all of this also feeds into video games. So what we see is technology. The left brain loves technology. It loves videos and computers and math and science and details. The left brain has more conscious memory and awareness. So learning, we find that individuals with autism usually have an incredible memory for details. Whereas the right brain is really more the social brain. It's more the nonverbal brain, understanding nonverbal cues. It's about attachment. It's really about connecting to other people. The right brain governs a lot of how we feel and connect to our body. So basic feelings like hunger, thirst, feeling temperature, cold and hot. We know that many kids with autism don't really feel those things or aren't really connected to hunger or thirst or urgency when they have to go to the bathroom or feeling hot or cold as much. And those basic feelings are foundational to other emotions that are in the right brain, like sadness, fear, empathy, and being able to understand what other people think and what other people feel, sense of humor. The right brain gets the big picture. So what we see is that the right brain is more spatial and more aware of 3D space. So when we look at the combination of these things, of different changes, this really perfectly describes what you see in autism, but it also accounts for the variation of all the various types of people that you see with autistic tendencies. But it's always this combination of too much activity on the left brain produces symptoms like tics and OCD, or, tantrums, or, their incredibly good skills. But it also accounts for many of their deficits or their weaknesses. They're, not understanding nonverbal communication as well, maybe not being as connected to their own emotion, not feeling their body as well, and being able to use that to build relationships and connect with other people.
Yeah, this very much explains autism from a 360-degree view. And while you were talking, I was able to think about secured attachment. It is such a deficit in our children. While most of our children are very good at mathematics, they're very good at rote learning. They're known as rote learners, but their dynamic intelligence is so poor. So dynamically, they are not able to navigate the world while they have all the data in their brains because they've memorized it.
Right.
Our explanation exactly maps to this description.
Even with the like the gut issues and the issues, it maps perfectly as well. The left brain activates the immune system. So we see most kids with autism have a hyperactive immune response, where they may end up with eczema early on in life, or asthma, or food sensitivities or allergies to gluten and casein. And it also explains why they have this persistent leaky gut throughout their life, because we're born with a leaky gut. So all of this maps out everything that you look at, and it fits perfectly into this overactive left, underdeveloped right hemisphere model.
Oh my God, I never knew that. And now I'm able to really understand the gut-brain connection, what we're talking about, and healing the gut. And now I understand that why almost most of our children are having a leaky gut when it comes to autism. I'm so thankful to you that today I'm able to explore this.
Yeah, well, a little bit further on that. I mean, what most people don't realize is that we're all born with a leaky gut, right? We all have a leaky gut when we're born, because we get our immune system from our mother and from breast milk. And these are large immunoglobulins, the antibodies we get from our mom. And so they have to get through the stomach lining. And if the stomach lining was fully mature, those large protein immunoglobulins wouldn't get through. But then at around 18 months, as our brain matures, the gut close up, and then we shouldn't allow any large proteins or polypeptides through. But in kids that have a delay on the right side, especially, but even left side as well, the gut doesn't close up, and it may not close up for their whole life. And so therefore, they get maybe gluten or casein or these large polypeptides that aren't fully digested, again, because their brain isn't regulating their autonomic nervous system. And so then they develop these food sensitivities because their immune system is hyperactive. Normally, we shouldn't have gluten or casein in our bloodstream. It should get broken down to the smallest amino acid. And if it does, then it shouldn't, if it doesn't get fully digested, it shouldn't get through the gut. But it does, because we have this persistent leaky gut. But even if it gets through, our immune system shouldn't react. But it does, because the left side activates the immune system and it's hyperactive. And this all comes together to produce this and causes inflammation in the body.
And not only that, the blood-brain barrier also is not able to stop these toxins to go to the brain, and the whole effects get just doubled and multifolded. Am I right? Am I right, Dr. Melillo?
The blood-brain barrier also isn't fully formed when we're first born. It has to mature. And if the brain isn't maturing fully, then the gut doesn't mature and the blood-brain barrier may not mature. And so it may stay more leaky as well, which then lets inflammatory chemicals through that normally wouldn't get through and create inflammation in the brain as well.
So when we are talking about these symptoms, I also would like to understand about the sensory dysfunction and sensory processing dysfunction. So what is the connection of SPD with the brain imbalance we're talking about?
Well,
Is there any connection?
Yeah, there's a direct connection. The right brain is really the sensory brain, right? The left brain is more motor. The right brain is more sensory driven. So, and the ability to integrate all of our senses together is again part of a maturational process. As our brain grows and as we get more mature, our brain becomes more coordinated. It grows and it becomes more differentiated so that we have more specialized areas, and the right brain and the left brain end up doing different things, although together at the same time. And so we look at the whole networks that lead up to that. And there are different areas of the brain, and there are different areas called Brodmann areas that control different types of sense and the ability to integrate them together. And the highest levels on the right side are Brodmann areas 39 and 40, which actually integrate the vision and body and auditory senses all together. So we integrate them. And they do that through this area called the thalamus. And if those areas don't mature appropriately, then the ability to integrate the senses, as I said, many kids with autism, because the right brain is really the more feeling brain, they don't feel things like pain or, to the same degree, or temperature or hunger, thirst. They don't have a really good sense of smell or taste. And these are all right brain functions. And it's really just that it's immature, that they're underdeveloped, and then they can't really integrate them together as well because of this functional connectivity issue.
So the way you're telling me, I don't see any reason in just working on the gut or working on the sensory system until and unless the core issue is addressed. Am I right?
All those things can be addressed to help with symptoms.
Mm-hmm. Yeah.
Reduce inflammation. If a child has food sensitivity, then it may be important to eliminate them temporarily. Again, trying to integrate the senses is important, but what we talk about is a bottom-up and then top-down development. So there's two types of integration that happen in the brain simultaneously. One is the brain builds from the bottom up, like building a building, right? Mm-hmm. And it starts through movement, as one of your colleagues said earlier, that movement is what initiates everything. And once a child goes through the different milestones of movement and builds these different levels of the brain, then they stand up and they walk, and then they continue to develop the brain. So this is what we call vertical integration. Once it's built from the top, it comes down and regulates all these things like the gut, the immune system, the hormone system. At the same time, though, there's what we call horizontal integration. The right and the left side of the body and the nervous system and the brain need to integrate and work with one another. So both of these things are happening at the same time. If they don't happen, that is the core foundation. So going to the brain directly and doing what we call top-down types of therapies, like behavioral therapies or other types of therapies that go directly, try to cognitively work on the child, try to build their relations or things like that. Or sometimes, even things like neurofeedback, educational type of training, all of that is good. But if you don't deal with the bottom up problem first, before the top down, then it may not work as well. So yes, you need to address these bottom up issues in the nervous system and the brain. And that really all starts with recognizing and integrating retained primitive reflexes.
Okay, so primitive reflex integration is the starting point.
Yeah.
And then, of course, the rest of the movements, proximodistal and cephalocaudal and proximodistal, as you said. So, so I really want to get into more details. That how does this program start for the child, and what is the process? How do we get a child into this program? What do we start with? What is the starting point of the program?
The starting point of the program is usually, obviously contact with my office or one of the doctors or therapists that I've trained around the world.
Mhm.
And like anything else, it starts with a history and making sure that, we understand what the issues are and think and make sure we putting together the proper type of exam. It starts with an examination, of course, but also it starts with, really understanding. So reading my book, Disconnected Kids, is what we start with.
For the viewers?
Yeah, because that really gives the parent or the individual themselves a chance to really understand, what we're doing. So because it is a relatively new approach, many people may not have heard about it. So, but as you said, as you read through it, it makes perfect sense. And most parents come to me and say, wow, it's like you knew my child. I don't know how you knew them and you never met them. But then the examination is, I've developed what's called Developmental Functional Neurology or neuroscience. And we look at every patient, whether they're 70 years old or whether they're, 5 months old, from a developmental standpoint. Is their brain and body developing in the different stages the way they're supposed to? And as we said, one of the most important things is looking at muscle tone and balance of muscle tone. And then also looking at primitive reflexes. This is, the subject of my PhD that I'm doing right now is in cognitive neuroscience, and it's all about the importance of retained primitive reflexes in autism. What happens with functional connectivity in the brain? How does it have an impact on that? And what happens when we integrate the reflexes, and how does that change functional connectivity in the brain? So what we see is that almost every child that we work with has retained primitive reflexes. Almost every adult we work with has retained primitive reflexes, because if these reflexes don't go away in the first year, they never go away on their own. But we can integrate them at any point in life. So, they are really the starting point. They're the critical piece. And this is what I tell parents, from the beginning, it usually starts with 3 basic things. We need to integrate the reflexes. We need to start to integrate and balance the brain by activating one side of the brain predominantly. In autism, it's always the right side of the brain. And then we also need to get the individual more connected to their body by improving their movement and their muscle tone and their coordination and timing in their body.
So what you are saying from that, I understand that we can start the program at any age, either for the toddlers or for the adolescents or even for the adults. Is it true?
Yes, it's true.
Okay.
It's
so
true.
I should not feel guilty if I was not knowing about the program when my child was young, and if my child is an adolescent now, even today I can start the program.
Absolutely. And we get results at any age. It's really just obviously when they get older, sometimes, it's harder to make them do some exercises or things that they may not want to do. Or so obviously, working with them as early as possible is great, but it's never too early to start, but it's also never too late.
And that's a great news. So while you were talking, one question which I was thinking about. So do you work at one side of the brain at a time, or does the method work on both the hemispheres at the same time? So it would be great if you could give me one example. So whether you work separately or together. So I'm not able to visualize it. So if you can help me with one example.
Sure. Yeah, we predominantly focus on one side, even though, we're doing exercises with the body, exercises or things that work on both sides of the brain. But our emphasis with the sensory stimulation is really on one side of the body, because the idea is that we need to create a balance to be able to promote it. The left side of the brain is generally overactive and actually more mature. I had a child in the other day who was actually in 4th grade and was reading at an 11th grade level, right? So you're talking about a child that's reading at, 6 or 7 years above their, so that side of the brain is already way too active and mature. The problem is the other side of the brain for reading comprehension is at a kindergarten level. So now you have to be able to create that balance. If you work on both sides, the strong side of the brain reacts first, right? So if we're doing everything equally and we're just stimulating the brain as a whole, we're going to impact the strong side more than the underactive side, and we're going to create more of an imbalance. So to create, if we have an unbalanced system, we have to address it in an unbalanced way. And this is a real critical feature that is what makes a lot of what we do unique. Most therapists, like myself when I was first trained, you're trained to do everything equally. If you do vestibular stimulation on one side, you do it on the other so that you don't create an imbalance. But if you're dealing with an imbalance from the beginning, then you can't do everything equally. So this is also why when children go through growth spurts, their left brain will advance more than their right brain, and they get more regressions as they grow. So they actually regress because the brain becomes more disconnected in that case. So it's very important to address that one side predominantly. And there's many ways to do it. Like, for instance, we have glasses that are different frequencies of color and light. And again, what we're doing is trying to change brainwave frequencies. And blue is a frequency that is more specific to the right side of the brain. And so we have glasses that are blue that flash only in the left half of both eyes. We'll put music predominantly in the left ear. We'll use other different electrical types of stimuli, like a TENS unit or a transcranial direct current unit. And so all of these things will maybe used in combination. And again, we're doing both bottom-up and top-down therapies at the same time, but we're also directing it towards specific areas of the brain. Not every area. What I've discovered is there's basically six different subtypes of right brain abilities and traits and features, and there's 6 left. So we can have all these different combinations, and we try to tailor design it to the individual child or adult.
And the traditional approach to therapy is that work on the strengths of the child.
Right.
And don't address the weakness. And after listening to you, it just sounds so unrealistic to me, right?
Exactly.
So if they're correct static learning, we just keep on filling them with the data and data and data. 100 words vocabulary, 100 color, 100 names of colors, and we are just not working on the side which is weaker. And as you said, the disconnect is widening and widening. And that makes so much of sense.
Yes, and you're exactly right. I remember years ago when I first came out with my book, I did a big interview, and the guy said the same thing. He said, the traditional approach in behavioral medicine is focus on the child's strengths and ignore their weaknesses, and you're going completely against that. And he said, what's your basis? And I said, well, if we just look at neuroplasticity research, like for instance, stroke therapy, in the past, stroke therapy, if someone had a stroke on one side of their brain, we'd do some therapy for a year, but after a year, we'd say, well, just ignore it. And now let's just, work to try to boost their strengths. And somebody, Dr. Taub, years ago said he didn't agree with that. And they did something called constraint-induced movement therapy, where they decided to restrict the strong side and stop, only move the bad side or the weak arm or make them speak. And that changed stroke rehab. It changed everything. Now, they were doing all the same therapies. The difference was they were focusing it only on the weak side and restraining the strong side. And many people now recover from stroke that would have never recovered from stroke. So it's a similar type of principle. But yes, you picked up on that. And that's a very, very important distinction.
Yes, and it's a paradigm shift in the treatment of what we are doing today. So what are the different types of inputs? For example, I have read the book and have read about the program. So, for example, music, light, smell, diet, exercises, which is provided in the program. And one more question I have here is rhythm is also considered important in exercises, which you give in the Melillo Method program?
Hugely important, because really it all comes down to synchronization, timing, coordination, and rhythm in the brain. one of the things we use for that is the interactive metronome, and we use metronome type of training and rhythmic training. There was an independent study of my work done at Harvard for ADHD, and at Harvard Medical School at McLean Hospital, the #1 mental institution in the United States. Mm-hmm. And they looked at a combination of, my method with interactive metronome. And they showed more significant changes that in the brain that they had ever seen before. And they showed that the treatment was as effective or more effective than any medication they had studied in 30 years, but that it also completely normalized the motor activity, which they had never seen before, and created physical and functional changes in the brain in ways that they hadn't seen before either. So yeah, rhythm, timing, there's an area of the brain called the cerebellum that we know is key to coordination and timing in the body. And it acts as a timekeeper for movement. And if the cerebellum isn't working properly, we know that we have very poor coordination and timing if it's not developed appropriately. So we see that kids with autism and other types of especially right brain deficits have poor coordination and timing and rhythm in their body. And this is reflective of that they don't have good coordination or synchronization in networks in their brain. And one of the ways to get their brain more synchronized is to get their body more synchronized. So that's a very, very important thing as well.
And that is the reason we have come up with this topic of the whole summit, importance of movement with relationships and consciousness, not just the skill-wise, but as you say, bottom up, right? Not top down, from movement to brain. And I'm glad that we're having this conversation, Dr. Melillo, because it's really, really, really making so much of contribution to our knowledge and our viewers' knowledge. Now, I will ask another question about, in 1970s, it was like 1 in 10,000. Diagnosis was 1 in 10,000. And I think today the statistics is saying, I think in United States of America, it's 1 in 30 boys in America are diagnosed with autism. So why are so many children are getting diagnosed with autism and ADHD?
Yeah, my third book was all about this, called Autism: The Scientific Truth of, of basically what we can do to understand what's happening and maybe, change some of those factors. It's a combination of a shift that we see in our society as a whole towards a very left brain dominant type of society. We really foster and develop left brain skills through computer technology. And so we see that the trait of left brain dominance and being, really good and super intelligent on that side is something that we're fostering more and more people that have that type of personality trait are getting together and having children. And so if you get two people that are very strongly left brain dominant, they tend to have children that are more left brain dominant. But then there's environmental factors, a number of different factors. I identified at least 50 in my book, and that book came out about 5 years ago. So there's more now that we're aware of, but there's many different environmental factors that elevate the risk of having a child with autism or some other disability. Some of those risks are the age of the mother and the father, exposure to things like organophosphates or pesticides or pollution, stress hormone levels in the mom and in the dad. Many of these are what we call preconception factors. So if there's inflammation in our bodies, high stress hormones, a high stress life tends to create what we call methyl marks or DNA methylation. And these marks attach themselves to the genes. And the genes that are most prevalent in humans, 85% of our genes are there to build our brain, to build these functional connections in our brain. So what we see is that our genes that build our brain are the most adaptive genes. They're built to respond to the environment. That's why our brain is so adaptive, that any society, any civilization, whatever culture we grow in, our brain adapts to our language and our culture really quickly, because the genes that build our brain design our brain to be very adaptable. But if we have negative environmental influences, or we're not getting those environmental influences, or we're blocking the genes that are supposed to react, then it has a big impact on our brain more than any other organ, and especially on brain development. So these are the factors, as well as the right brain forms first in the womb, and then for the first 3 years. And male brains are more dependent on right brain development. Women have more balanced brains to begin with. And male brains, we start out as female brains in the womb. And even if we have an X or Y chromosome, we start out as a female platform. And it has to be converted to a male brain by the right amount of hormones at exactly the right time in the right concentrations. So if anything is causing stress into the mother, it has more of an impact on a male brain and on the right side of the brain than on a female brain and on the left side of the brain. So all of those factors together, I believe, are why we see this incredible rise in autism and ADHD and other right brain deficient issues like OCD, tics, Tourette's, schizophrenia, anxiety issues, all around the world.
And I think your explanation also explains that why number of boys are 4 times more than the number of girls being diagnosed.
Exactly.
I see some connection there.
Mm-hmm.
So, and also, I don't think that autism has any genetical basis. I mean, we have completely understood autism as not being genetical, but more of epigenetical. So what is your opinion on that?
Well, there's two types of autism that we recognize. One is called syndromic and the other is non-syndromic. Mm-hmm. Syndromic are children that have some known or unknown genetic mutation and also are diagnosed with autism. And that makes up about 10% of kids in the autism world. Again, to me, that is really what we look at as autism. That's a genetic disorder with autism features. And then 90% have what we call non-syndromic, which means there is no genetic mutation, that it is predominantly epigenetic, which means there's nothing wrong with the genes. The thing that makes it genetic is the trait that it's built on, right? So that Simon Baron-Cohen out of Cambridge, who's a big autism researcher, has done much research showing that, you know, families of children with autism, you have people that are mathematicians and physics professors, and anywhere in the world where there's a concentration of people in the IT industry, like in Silicon Valley, or he did a study looking in Holland, wherever you have a concentration of people in that industry, you see a very high concentration of children being born with autism, especially Asperger's type autism. Mm-hmm. And so, you know, that it is a trait, and the trait, the way I define it, is a left brain dominant trait. We're all either more left brain or right brain dominant, just like we're all more right-handed or left-handed. And it isn't a big difference, but it's a subtle enough difference that it you know, makes a difference in our abilities. And some people are just born with certain areas of their brain are a little bit more connected, and that's why they are more talented or can do certain things better. I mean, talent or genius is just an increase in connectivity in a specific area of the brain that is associated with a specific function. But the only thing is, when you have an increase of connectivity on one side, you usually have a slight decrease on the same spot on the other side. Mm-hmm. That's normal in all of us. We all have strengths and weaknesses. But in autism, we see an extreme version of that trait, and we have these extreme abilities and over connectivity in the left side and under connectivity and under development in the right and in the two hemispheres.
So one more question which is popping up into my mind right now, especially in our cultural context in India, where academic studies are really given too much focus on. And as I see after listening to you, that academics, language, mathematics, they are the products of the left brain again.
Yes.
And if we are not looking at all into the social coordination right from the beginning and just want our children to study, be very good at maths, we are increasing the disconnect, isn't it? Would you like to say a word about this? Because I think our audience really need to listen to it.
Yeah, well, listen, both sides of the brain are always working. Both sides of the brain do different parts of the same coin. So like, for instance, the left brain is very good with basic math operations, calculations, numbers, memory, rote memorization, calculus, algebra. But the right brain is good with spatial math. So things like geometry or physics, or, the ability to kind of see the big picture and be more creative with math. So both sides of the brain do math, but the type of math that we see with zeros and ones and coding and those types of things are very specific to the left brain. And so, yeah, there's a really interesting book by a famous psychiatrist out of the UK named Ian McGilchrist. It's called Master and His Emissary, the divided brain and the building of the Western civilization. And in it, he talks about how we're getting much more towards this left brain type of world. And the left brain type of world is more disconnected from other people. It's more individualized. It's more ego driven. It's more goal directed. And it is more isolated, but it's more intelligent, let's say, when it comes to facts and ideas and remembering things. And the right brain is more the connected brain. It's more connected to the whole world and other people, and is more altruistic and isn't so ego driven. And what we see in the world right now is there's only one really pure emotion that's left brain, and that is anger. And right now we see the world becoming more disconnected, more isolated, more politically polarized. We see more anger amongst people. And I believe that that's because we're driving ourselves more as a left brain society, the more technologically advanced we get. So in societies, and you're right, I speak with many Indian families, and they tell me, if you're not, like an engineer, or you're not a scientist or a doctor or a lawyer, you're really, not, that's what everybody over there wants to see their children do. And so anywhere where we see societies going towards really this technology and forgetting about the right brain and the human side and the emotional side and the emotional intelligence side, we're losing a lot. And we also see a rise of these issues like autism.
Yeah. So I would like to sum it up, this message especially. Our children will be good at mathematics or studies, but just don't make that a focus. Please make sure that social coordination, the right functions of the brain, gets addressed right from the beginning. That's very important.
Yes.
Now, I'll move to the next question. Very quickly, if you can tell me, sum it up. So what does intervention look like? How long does a child should be in a program? And if you can show one activity, that how does hemispheric integration look like? It's like a little bit about the program, like the tools, house of it.
Yeah,
how long should a child be on a program on an average?
On average, if we're dealing with a child with an autism diagnosis, especially with a child that is nonverbal, we're looking at, initially at least a year, right? So we think in terms of that year. If a child is very high functioning, it might be less, but in general, we're thinking in terms of a year. It might end up being more than that, but if I'm seeing them in my office here, I would reevaluate them every 3 months. And we use functional measurements. So we're not just going by symptoms. We're looking at cognitive measurements. We're looking at physical measurements. We look at timing and rhythm and coordination. We may look at some lab work and look at if they have a leaky gut or food sensitivities. We do, behavioral tests. We look at all different types of things: visual processing, auditory processing, hearing, vision, their sense of smell. This is a huge thing that most people never even look at. The sense of smell is one of our most foundational senses, and it's connected to the social brain, and especially the right side of the brain. There's an area called the rhinencephalon, which is called the nose brain, which is part of our limbic system, which is connected to our basic emotions and feelings. And most kids with autism, they have no sense of smell. Even if they sniff things, we find that they actually aren't smelling anything. And this is often why they're very picky eaters, because they don't choose it that way. So we look at all these functional measurements, and then from there, we design a program. If a child is here in our office, they may travel from around the world. We see people from all over. They may come here for a week. They may come here for a month. They may come here for 3 months or 6 months. And we work with them generally every day, twice a day, for generally around an hour to an hour and a half, twice a day. And they come in and we use a combination of really neat technology. We'll do primitive reflex stimulations and exercises, core exercises and physical exercises that work on muscle tone balancing. We use sensory stimulation like light and sound and music and movement and vestibular stimulation and eye movements. We also have something called a NeuroSage, which is video games that we have created that are actually good for the right brain or the left brain, that have specific frequencies of music and sound and light, and create different specific eye movements and work on different cognitive skills. As we're doing that, we're co-activating multiple areas of the brain at the same time. So for instance, a child might be standing in front of a video screen while they're standing on a vibe plate, vibrating them at a specific frequency, like 10 hertz, which is the same frequency as the cerebellum and the same frequency as the motor cortex. And then they may have special glasses on that are activating the visual cortex in their brain. They have what's called a TENS unit, which is a little electrical stim unit on their upper back or somewhere on their body on the left side, that is stimulating the right parietal lobe in an area called 312, a Brodmann area. And then we'll be listening to music that is activating the temporal lobes and is going to different areas associated with auditory processing. At the same time, we may have a transcranial unit on their head that may activate one side of the brain and inhibit the other to create a balance. We also may have multiple lasers on them at the same time using red light or infrared light that is inducing different types of brainwave effects. So we're inducing different brainwaves in specific areas and specific networks in the brain that correlate with what we found where the child is deficient. Sometimes we may have to dampen activity in the left side of the brain if they're overactive, and bring up the right side simultaneously. And we're also advising them on nutrition at home and diet. We then may have them work with a teacher that may do academic skills with them, or may actually do some facilitated communication type of technique with them. We also have neurofeedback, which is something that we do later on. We may do really sophisticated, elaborate eye movement and eye exercises with them and help them with reading or other issues related to their vision. So, we have a combination of many, many different things we can use in almost a limited type of combination. Each child is individualized, but they come here and they work with that. If they're working virtually, we will get them to get some equipment, and then we give them videos and we train them as to how to use this at home and teach the parent how to often stimulate or activate the primitive reflexes, and also give them some guidance on vitamins and nutrition and things of that issue. I've created my own specialized vitamins for the hemispheres and for the gut. And so we usually advise them on that as well.
That looks very promising, and I'm really excited about it. So what kind of outcomes have you seen with the program?
Well, our outcomes are pretty great in general. And we work some of the most severe cases. We also work with brain injury. We work with seizures. We work with, children with genetic issues. But when it comes to autism, I'd say that, generally, if we have a child that is not speaking, on average, we see that within, 6 to 8 months, they're speaking at various levels. We have some children that within 1 year, we have them caught up to where they need to be and they lose their autism diagnosis completely. We have other children that are, 50% improved, 30% improved. But we get pretty drastic improvement in all of the kids we work with. And, our motto, and I tell parents, is your motto is that change is good. What we're looking for is change. Most of the parents, when they come, they say to me, they haven't really seen much change in many of the other therapies that they did. And so therefore, that's what they're looking for. And I often tell them, well, you're going to see change, and the change is probably going to be pretty dramatic. It might sometimes, you might not always know, is this a good change or a bad change? Because as we get changes in the brain, as some areas grow, we may see regression in another area temporarily, or as the right brain starts to come online, we may see that the child all of a sudden starts feeling sadness or fear, or, they feel embarrassment, things that they've never felt before. I had one child recently with autism that we worked with, and they, all of a sudden their right brain kicked in. They had horrible tics, and these tics were as hard as I've ever seen them. And within 2 weeks, we were able to get rid of these tics. But then her right brain came on, and she started feeling this overwhelming sadness and fear, which she had never felt before. And I explained to her that, this is what everybody feels. And she looked at me and said, everybody feels sad? Everybody feels fear? And I said, yeah. And she said, I didn't know that. So we don't understand that if you don't feel something, you can't understand what it feels like in somebody else. And that she was a very high functioning, bright, talented girl. From her father's a very famous actor and comedian. And she had no idea that other people felt that. And so when that comes on, it can be scary at times, but these are good changes, and we are there to explain them to parents and guide them through the process.
Now I can understand one phrase I heard from a neuroscientist, that children on spectrum can see the behavior, but they can't feel it.
Right.
They can see a feeling, but they can't feel it. And everything is like really like a puzzle fitting into that description. So how does the Melillo method account for the anxieties and the poor sense of competence the children have about themselves, which leads to, of course, their poor intrinsic motivation? So do you see a change in motivation, sense of competence, feeling good about themselves, lesser anxieties?
Yeah, all of these things are really neurological, right? So we often describe them in psychological terms, but they're also really the basis of them is neurological. So motivation, there's an area of the brain called the anterior cingulate. And on the left side, it increases motivation. On the right side, it can decrease motivation. Now, that's one aspect of motivation, but also there's different types of motivation, like motivation to be social or to interact with other people or connect with other people. Again, the left brain really does a lot of that, but the right brain is really our motivation to connect with other people. Anxiety and depression are two ends of the spectrum. A left hemisphere deficit is associated with depression, sadness, fear, really a lot of negative thoughts, and maybe being hyper self-aware. With the right brain deficit, we see this is more anxiety and it can be more where there's kind of confusion because they want to connect with other people, but they really may not know how, and they may feel isolated and alone. And so that may affect, obviously, their self-esteem as well, how other people treat them. They don't understand why other people aren't understanding them, because they don't understand how to really read those type of cues appropriately. So it really comes down to, again, addressing different areas of the brain and being able to activate and create this balance. Too much right brain, too little left brain, you're depressed. Too much in the other way, you're anxious. So all of these areas are just networks and areas of the brain that are related to neurology.
So now we have come to the last question, Dr. Melillo, and it is a little philosophical question because I really want to connect everything for our viewers. What advice would you give parents who get lost into the doing of the method? Like, do, this is the exercise, just do it, like, right? should parents be more aware and also understand how to be with their child and integrate the effects of the method into functional life for more independent thinking? What is your final advice on this?
Yeah, of course. I mean, obviously, the right brain starts with attachment to our parents and connection to other people. And so, the parents, spending as much time and interacting with their children, we often encourage that the parents get on the floor and do the exercises with the children or do it as a whole family. We don't want one child to be isolated like this is a punishment for them. And most of the children really love it when their whole family is working together. But by the same token, it's not a failure. Autism is not a failure of the family or the parents to try to connect with their kids, because it is that the child's brain isn't receiving the signals. It's not like that the parents aren't trying and they don't love their kids and they aren't great parents. They are. But as you said, sometimes we get so into, just the left brain analytical, let's do this. We got to remember that the experience is really the right brain, feeling emotionally connected to everybody else, and making it an enjoyable process is also something that's very important.
And that's the whole idea of Brain Balance program as I see it. Dr. Melillo, we have come to the end of our conversation. On behalf of PlayStreet team, I would like to thank you again for your valuable time and for sharing such a depth of knowledge. I'm really, really elated that I'm able to talk to you today. I hope all the viewers have got knowledge about the Melillo method and how it is used to identify brain imbalances and treat many symptoms of mental, attention, behavioral, and learning disorders, and also how this revolutionary approach is paired with diet and nutritional counseling and lifestyle modification to help promote brain and body balance, effectively correcting the underlying problems common to the entire spectrum of the challenges that the children are having. Thank you everyone for joining us today. Take care and goodbye.
Thank you.